Okay, so this is what the Open Clinical database should look like. The sort of opening page of it. So I'm just going to scroll down to our most recent participant. So if you click their trial number here, and then it opens up all of the different forms. So to edit the paediatric follow-up form, you click this button here, edit. If you've not, if the form hasn't been created yet, then like if this was a new patient, then you would press schedule, and you would schedule the paediatric follow-up form, and then you could edit it. But this patient has already been done, so I don't need to schedule the form. So this is the first page of the form. So it's quite self-explanatory. You just enter their demographics here, here, and here. If the answer to this one is yes, then it will populate this data point, and then you can add that in. Again, this is a question that if you click yes, it will populate a new data point, and it asks you to round up as opposed to just counting the days. So even if the child was there for 24 hours, if the child was in ICU for 25 hours, you would still need to put 2 days. Again, rounding up to the nearest day here for the question about inotropes. And then it will ask you about ECGs and echoes and things. So if you click no, then it will populate this box. And you can add those data points in. And again, for the echo, if you were to click no, then it would populate this box. So it's quite self-explanatory, really. You just answer the questions and sort of follow it along. And here is the blood results page. So this is the next part of the paediatric follow-up form. So the date of admission will already be automatically populated for you, so you don't need to type anything in here. And these dates here in the grey boxes will be automatically done, and this one you add in yourself. So you enter the time and basically just enter in each blood result. Sometimes it will come up with automatic queries, but usually if you've entered the result, you can double check it on your EPR and just answer those queries immediately and just say this is the correct value. And if there were no blood results, then just click select if not available, and then it won't ask you to put any in, but it still will populate the days. So you do that for every day that the patient was at your site. And like here, for example, there weren't any blood results done on this day, so I clicked select if not available, but because the patient's still with us for another day, I still added another day. And if you want to, for example, if the patient had been with us for 5 days, then to add another section, another day for more bloods, you click the plus button, which I'm just going to do now just to show you what it would look like. So then I would add in the bloods here, and if you sort of, for whatever reason, accidentally press that button, or you make an error and you want to get rid of it, then you can press this button here to get rid of the day. But for now, I'll just move on. And now this form is, I think this is the penultimate page here. So it basically will ask about all of the different, it will ask if the patient has had any of these treatments. So again, if you click yes to any of these, it will ask about dose and date and number of doses. So for example, let's just say, for example, the patient did have steroids, and I'll click yes, and now it's populated new data points. So it asks me to fill in the dose, the date first received, and the number of days given, but this patient didn't. So and when you change your answers, as you'll see here, it asks you to enter a reason for the change. So you would enter that down here. I'm just going to put no change. So again, it will ask about steroids and all of these treatments. You can just again, like if you click yes, it will populate more data points, and you just fill it in accordingly. And if there's ever a situation where you don't have the source data, you can just add an annotation, which I'll demonstrate now. You can add an annotation and just put, say for example, I didn't have the source data for whatever reason, I could just put not known or something like that. And then this is the final page. So this is the additional phone call or appointment for 5 to 8 weeks post-discharge from the site. So it asks if the patient was ever positive. Now, when I first started doing these forms, I slightly misunderstood this question, but this is asking if the patient was ever PCR positive, like not just at the follow-up appointment, but any time during the first admission, or I think 2 months prior. I can't remember the exact timescale that it gives, but say for example, if you clicked yes, then it asks for the date, and then it asks about the antibodies, whether they were positive or negative during the first admission, and then it asks again about the follow-up, and then this part here, the CRP. So it might seem like a slightly misleading question, but essentially the question is asking about the CRP value for during the first admission. So even if your patient had bloods done at the follow-up appointment, which you would expect it to be the lowest value at the follow-up, if you enter that and put, so for example, I think this patient's follow-up was done in June. So if I put, for example, 5, and then I put, in fact, I'll just show you what it looks like. If I put 5, and then I put the date of the follow-up, it won't allow me to do that because it's asking for the CRP value from the first admission. So it can't be before the first hospital admission date or after the date of discharge. So I think it was 22, and then I'll check that date later because I don't remember what it was. So again, treatment at discharge, this is referring to the first admission, not the follow-up appointment. Again, can be slightly misleading because the title of the form is the paediatric is the 5 to 8 weeks post-discharge, but this question is asking about the first admission. So you just enter those dates, and then it asks if the child or the patient visited a GP, if they've been admitted to hospital again. Now, often the answer to this I've often put yes, because because they're weaning steroids, they would have weekly bloods done at their local. So I would often tick yes, and then I would put an annotation saying weekly bloods done at local while weaning steroids, but no recurrence of PIMS. But that's not the case for this patient.
Though I think, Emily, for admitted to hospital, that would be a no if you're just coming for blood tests, actually. So I think I'm really sorry if we've confused the world with that one, but no, this is about an overnight admission and then entering a reason. So I think that's okay. I think if you don't have to change your forms because you put the annotation and we'll be able to work it out. But to make it easy for people, that's about an overnight admission.
Okay, cool. Cool. So another example of slightly misleading questions, which we all make mistakes, it's fine. If you're ever confused about things, just put an annotation. That would be my piece of advice.
That's perfect.
There we go. Cool. And then echo, ECG, asks about the date, and that's it really. So that's pretty much that's the long and short of the paediatric follow-up form. And then you close, and that's it. Yeah, that's it. That's how you enter the paediatric follow-up form.
And